All right. What is up, guys? We're having some technical difficulties, so unfortunately are not able to go live for you guys today. So you're just going to have to watch this as a replay, but it's going to be a post because, again, couldn't go live, so replay is not going to work. So we're just going to feed the questions that we have gotten over the past, 2 or 3 weeks, forget when we started collecting them. And then if you were going to log on at 2:30 to ask us any questions live, post them in the comments below, and then we can do another video and readdress those ones. Instagram just created this new rule that we just found out about a couple minutes ago, that you have to have at least 1,000 followers in order to start live. So tell all your friends we need 275 more followers before we can do a live for you guys. That'll help out a lot. So we're just going to go through a couple questions, and then we're going to go pass the mic around to the different individuals here. So we got Anna, Madison, Jackie, and Matthew joining us. Obviously, I'm Derek. First question is from Liz. How can I work on shoulder pain? You want to do it?
So with shoulder pain, one of the things I like to start with is getting it moving, stretching into your lats, doing some down dog, getting in some child's pose. These are great ways to kind of get the shoulders moving. Using a yoga ball on the wall, you can go side to side. If it's a little bit stressful putting all that weight through your arms for those other exercises. I also like to get the chest nice and open. Sometimes that can kind of roll you forward and impinge some of that motion. So getting into the doorway, giving yourself a nice chest stretch in the doorway is a great way to free up some of those muscles that can restrict some of that motion. If you're finding it's hard to get through full ranges, things like walking your hands up the wall, doing little snow angels against the wall will give you a little something to brace against, get some motion into that space, and allow your muscles to develop some strength through that range. So a little couple quick and easy ones.
Perfect. Thanks, Matt. And then outside of that, if it's still not working, see a PT. Doesn't have to be us, but see a PT. But come to us. The next question is from Lauren. How can PT help you during and or post pregnancy? So I'm going to hand the mic off to Anna here.
Okay, so if we're talking about during pregnancy, there's a lot of stress that goes on to our low back, SI joint, hips. So during pregnancy, PT can really help with just some of that pain alleviation and make it more tolerable, especially third trimester as you're carrying a lot more weight. After pregnancy, PT plays a really big role in rehabbing a lot of things. Pregnancy, birth, labor, all can be very traumatic. Your pelvic floor goes through a lot. So pelvic floor physical therapy is something that we can provide that retrains your pelvic floor to kind of work better with the rest of your body. So we're going to work a lot on hip mobility, hip strength, low back, pelvic floor engagement, and connecting that to breathing. So post pregnancy, it's a lot of slow breathing to work up to lifting heavy weights again, or just walking, running, doing whatever you want to do without pain, without difficulty. So PT is really helpful for both during and after pregnancy.
Nice. I feel like that's a topic that not a lot of people know anything about and is relatively new to PT. So lean into us if you aren't sure, hey, I got this thing that's hurting me, but I don't know when to see a PT or see a doctor. Just shoot us a message and we can help you navigate that. Even if you don't need PT, we'll try to help point you in the right direction. Lauren hit us up with a few questions here. This one comes to me. What days does Hennessy work? That is probably that should be an FAQ on the website because everybody wants to know. Mondays, if we didn't have a busy weekend. If we had a busy weekend, Tuesdays. If it was a really busy weekend, not until Wednesday. And then at that point, it's probably only coming on Wednesday. But we shoot for twice a week, either a Monday, Wednesday, Monday, Thursday, or a Tuesday, Thursday, Tuesday, Friday type deal. If people have a strong request for Hennessy, I try to make the patients happy and bring them in when they get on the schedule. So it's very dynamic, right, Menace? The next question's also from Lauren. What does red light therapy do? Great question. So red light therapy is a very new hot topic that a lot of people are starting to utilize this technology. And in truth, it's an umbrella term. So red light is a type of light wave that is produced on the light spectrum, and then it goes up to near infrared, or at least our machine produces that. At various different levels of wavelength, the light wave will dive at different depths of tissue into the body. So red light's very superficial. We got the skin, the fascia, fat cells. It's going to affect those layers. The near infrared's going to dive into the joint spaces, down into the muscles a little bit more, and then all the way into the nerves even to help control inflammation. What those light waves are trying to do is, like I just alluded to, impacting and decreasing inflammation, reducing oxidative stress in the cells, and then increasing mitochondrial function is the biggest takeaway from red light therapy. By stimulating our cells' mitochondria, this produces more energy, ATP, for our cells to use. Therefore, they perform their natural biological process 4 to 10 times faster. So really good for healing, chronic inflammation control. Those two things combined work really well with autoimmune conditions, arthritis, things that we know inflammation is just going to kind of linger for a little bit. But anybody would benefit from red light, even from a sports performance recovery situation. Any other specific questions? Go ahead and feel free to drop in the comments. Maybe for Jackie here. What's the process of getting into PT? Do you need a referral?
Well, the process of getting in is calling me, and I will schedule you. And referrals. Good question, because the state of Michigan says you need a referral within 10 visits or 21 days, whichever comes first. But we can also send a plan of care to your primary care physician if you have that, and as long as they sign off on it, then we really don't need a referral. That will work as the referral. That's if you're using your insurance. If you're not using your health insurance and you're just paying cash, there is no referral needed.
Perfect. Thank you, Jackie. Let's see. What are the short-term and long-term goals of Metro? That is a good one. Matt, I just want to have you look at that second FAQ just to kind of prime you for that if you want to try to take a whack at that one. Short-term, long-term goals. Short-term is to just try to grow our mission and vision, which is to deliver high quality care to our immediate community, spending more time with our patients, being able to educate our patients on how to maintain this body that we all have that starts to ache at some point in our life. That gets overwhelming to manage. So we want to be a go-to source for valuable educational content. Beyond that is just growing, adding a couple more clinicians. We'll get a little bit bigger. And then, honestly, long-term goals, we'll kind of see. We're all about trying to see where the universe wants to take us. The common trend is that we're just trying to do the right thing in this system that makes it kind of tough to deliver high-quality care. So in summary, it's just trying to take care of our community and grow our community to help one another. Yeah. You want to try it?
Yeah.
All right. The next question was, what do I wear to my first PT appointment?
I think that you should wear something you feel comfortable with because you're going to be moving a lot. Maybe come in with some gym shoes, some socks, maybe like a little bit of athleisure. Just because you're going to be moving a lot, and the way that you move, you don't want to be uncomfortable or kind of like a little stiff if you were to like wear some jeans or something like that. You just want something that you're able to move in and something a little breathable just because of the exercises and the work you're going to be doing.
Perfect response. And then like if it's your shoulder, like don't wear a sweatshirt, like type thing. Like for us to be able to see the skin, I think you guys would agree is a huge advantage, not only for assessment but for treatment as well. It just gives us more options to use treatment. Sports bras are helpful too, so that we can kind of see your shoulder blades move around. Cupping, needling, scraping. Graston, whatever you guys want to call it, but all those modalities become more accessible. Is PT painful? Who wants to? Yeah, I think that's well suited.
It's pain and torture. No, I feel like PT is not all sunshine. There, we're gonna push you a little bit, but it's one of the big things we always push is patient tolerance. We never try to treat pain with pain. Post-operatively, we're going to be working some ranges. We might have some sticky spots, but it's a very, we always get that. It hurts so good. That's a thing we hear quite a bit. And so I'm not saying it's going to be all fun and soft hands, especially these mean old thumbs. But we're doing it to help get the range back, get some blood flowing in there, and every time afterwards, it's like, oh, it's moving so much better. So we get those returns, and it's always got some good benefit to it.
Perfect. It's, you have to go through a little bit in order to get that long-term goal. So if you can't move for a reason, because tissue's restricted, it's not going to be great to undo that. But once you undo it, man, things are feeling good. How is my progress measured during PT?
So we measure progress in a lot of ways. We start with strength, range of motion. Those are ways that are very basic that we would use for insurance purposes, but really the most important way for us to measure progress, in my opinion, is like a patient's function. So if someone comes in and tells me they can't maybe go up the stairs without pain, then I'm going to measure their progress by, are they able to start going up the stairs with pain? Or maybe they can't get through one of their workouts without pain, or their symptoms coming on, are their workouts getting easier and more functional? So that's, I think, the most important thing is whatever the patient's coming in with their difficulties, is that getting better? Are they being more functional, more active? Agree.
Yeah, no, I agree. You agree?
Yeah, collaborate on goals for sure.
Mm-hmm. Great word. Collaborate. I would say like that's like one of the keywords that we use not only between us as a team, like we collaborate how we like work with our patients and make sure that they're getting the best treatment possible, because like Matthew knows things that I don't know, Anna knows things I don't know, and that's all interchangeable. So we've really created like a collaborative team approach to patient care, but also collaborate with our patients so that we are ensuring that we understand their life as much as possible, so that we can really help them identify their pain points and improve their function optimally. Yeah, so love that. What happens after PT? Anybody want to take it? Or? I can do it. Okay. That can go in a million different directions. So what happens after PT is, well, we are working towards your goals. So we're assuming that we've achieved your goals. So some people just want to get back to going up the stairs pain-free. Maybe they're not interested in exercise or necessarily taking it to the next level. And that's okay. Like if they just wanted to get out of pain so that they can live their everyday life, cool, mission accomplished. I always like to see people like maybe check back in to make sure that we're continuing to make that progress over time. Maybe some like monthly maintenance visits. But as far as like people wanting to get back to weightlifting or sports performance, that's where it gets a little bit more detailed. Is maybe we accomplished your PT goals, but we've been able to educate you on so many techniques and recovery methods that you've been like, hey, I'm actually performing better than before my injury. Well, let's keep some of those modalities. Maybe it's dry needling or cupping or compression therapy, red light therapy. Let's keep that in your routine so that you can not only continue to get stronger, prevent injury, but maybe you start working on other body parts that you feel restricted in. And then kind of the sky's the limit from there. So PT it can get you out of injury, but it can also like take your quality of life to that next level. So that's really what we want to see at the end of the day. Anything to add to that?
No, I agree.
Good. And then the next question, we kind of just talked about this last week in our team meeting, actually, because we had a lot of patients asking about it. Difference between OT and PT. Does anyone want to take a whack at it? Madison, Jackie? You don't have to. You don't have to. All right, cool.
So like he said, we were talking about it last week, and OT, occupational therapy, is right. That's what it is. I feel like it's more getting people to do things that I feel like you wouldn't necessarily think about, like someone trying to like button up their shirt, or like maybe like writing, things like that, like trying to get them back into doing those things. Physical therapy, I feel like it's kind of a bit of a more broad range. Like Anna was talking about, like, you know, post-pregnancy or while you're pregnant, or even like, you know, getting back into sports recovery, things like that. I guess, I don't know. I feel like this OT help with like the fine motor skills.
Fine motor versus like gross motor.
Yeah, versus, So I feel like OT, you work more on those things that might be just, I don't know, like, like a little more challenging in that way. Yeah.
Yeah, absolutely. Yeah, I agree. It's a lot more of those fine motor type skills, getting the dressed, and to kind of just, once you get to where you need to go, what are you going to do? PT helps you like with the larger movements and to get you there. But yeah, you nailed it. You were just more specific. That's all. Perfect. That's all the questions I have right now, Alex. Were there some others saved elsewhere? Okay, I'll just wrap up then. All right. Thanks, everybody, for tuning in to our replay but not replay. And hopefully we get 275 more followers within the next couple of months, and we can actually do a live stream for you. Thank you, everybody, for all your support, and we will see you around. Yay! Nice job, guys.